button. There we go. Okay. Real quick, what's your name?
Okay, my name is Rochell Bryant.
Okay,
Rochell.
okay. Rochell Bryant, you based out of Arkansas.
Out of Arkansas, yeah.
Okay.
Marietta, Arkansas, about 45 minutes from Memphis, Tennessee.
Okay, okay. And you also are SC hemoglobin as well, right?
Correct.
Okay, okay. Just in a nutshell, real quick, how would you describe sickle cell anemia to someone who doesn't know?
Okay, if I had to describe it to someone who didn't, know what it was or didn't know anything about it, I would just say it's an inherited blood disorder that's inherited from, both parents. It causes healthy hemoglobin, red blood cells to turn to the sickle shape. Mm-hmm. And when those sickle cells try to go through the vessels, it's very painful. It causes chronic pain. Okay. And fatigue, a lot of different things that comes along with that.
Okay, okay. So when was you diagnosed again? At what age?
3. I was diagnosed at 3. And what I was telling you is that I'm from a very rural area in Arkansas. And so I'm 42 and I was diagnosed at 3. So this was in the late 70s because I was born in 79, early 80s. Mm-hmm. So I wasn't diagnosed about 81, 82. And they had never, my mom didn't know why. She knew I would cry all the time and, mm-hmm. Just couldn't uncontrollably crying, and she didn't know why. And I wasn't old enough to talk and tell her what was wrong. And so all we had was this little clinic here. And, they didn't see, severe stuff. They just saw stuff like high blood pressure or a cut or a scrape or something like that. Mm-hmm. But she would always take me to this clinic when I would be sick like this, had a fever, just lethargic, and would be crying. And they couldn't tell her what was wrong. So one day a nurse happened to be there. I don't know if this was a new nurse or a nurse that had never seen me before, mm-hmm. but this nurse told my mom that I think this baby had sickle cell anemia. And my mom was like, sickle cell anemia. My mom had never even heard of it before. She didn't even know she had the trait. Okay. And so, the lady, yeah, I think she has sickle cell. She has all of the signs and symptoms of it. What we just have to do is do a blood test to confirm it. Because you remember back then, everybody was not tested for sickle cell when they were born like today. Right, right. So finally, they sent me over to Memphis, Tennessee, to mm-hmm. Labona Children's Hospital. That's where I was diagnosed officially, and that's when I started receiving treatment. So I was 3 years old. Okay, so are you the only one in your family, your immediate family with sickle cell? Yes, out of the 6 kids that my mom and dad had together, and we all have the same mother and father, I am the only one. Okay, where you fall in place out of the 6? The third. The third. And I asked that, right, because I always wonder how is that, because in my family, I'm the only one with sickle cell, mm-hmm. and I'm the 3rd child. Really? As well, right. And I have met other people with sickle cell, and I asked them the same question, and they always end up being the 3rd child. Well, I had a drawing, and I don't know what I did with it, that the doctor I saw the other day in Memphis drew for me. And she explained that to me, explained why that was to me. And I don't know what, I'm trying to find that drawing. But you know what? My nephew, now, my brother's son, he's the mm-hmm. 3rd child. Mm-hmm. And he also SC, hemoglobin. So I don't know. I always wondered what that was about. But have you ever had any surgeries? Yes, I've had my gallbladder removed. Mm-hmm. I've had a hernia surgery. I've had left knee surgery. I have a port, so I had a port in place. Mm-hmm. And I've had a tubal ligation. Those are about the only ones. Okay. So I think I've been pretty blessed. I've heard of people having a lot, more than that done. Actually, I have 2 metal hips, a metal shoulder. Really? Yes, I had my first metal hip replacement when I was 22. Then I had another one at 29. Then I had a shoulder, 26. So you have 2. So you say you have 2 metal hips and a metal shoulder. Is it from avascular necrosis? Yes. I think I'm just now starting to experience that. Where are you experiencing it, in your hips? In my hips, yeah. Yeah. And when you and my knee. Do you have it in your knee?
No, knock on wood. I'm tired of getting cut on. You hear me? But you
No,
know,
I'm saying, can you have it in your knee?
yes, anywhere.
Okay.
Yes, any joint.
Mhm.
Because avascular is basically the blood stop flowing to that bone and the bone dies.
Okay.
So, and when the bone dies, it start to deteriorate, and they have to replace it with metal joints. So yes, I have, and what the symptoms that I had back then, when I went to go sit down on the toilet and take number 2, I get stuck. So you know,
I
yeah,
think I'm just starting. I'm just starting to experience those now.
yeah, I get stuck, and then it'll pop, and you know, are you in there? Yeah, yeah. But one thing I can say, I'm glad I did get the surgery, because for the longest I was walking with a cane, and at 22 years old with a cane, you know. So at one point I had a cane and an eye patch because a blood vessel burst in my eye. So you know, I had a lot of different surgeries,
and that's crazy because I keep hearing, and I've heard this from the last 2 doctors that I've seen. Well, SC patients don't usually have any problems like SS patients. I hate to hear that, but the last 2 doctors I've seen, I just moved back here to Arkansas from Georgia, and the last 2 doctors that I've seen, the first thing they want to holler about is, "Oh, you look so well for someone with sickle cell at 42." Which what is it?
Right, but see what that is, and the reason that is because everything is tested for SS, right? Like, have you heard of the drug hydroxyurea?
I'm on it now.
You want it now? See, the crazy thing about hydroxyurea from back then, I'm gonna double check, but hydroxyurea was only proven for SS. It was never proven for SC, right? And people don't know hydroxyurea is actually
a cancer drug.
A cancer drug, which can have symptoms of cancer, right? So I was on it years ago, and I stopped taking it because I went through a phase in my life where I got tired of taking medication. And I stopped, and I got real sick. But if it's helping, it is good, because I know it's supposed to help your F2.
I just started back taking it. I'm talking about 2 days ago. I do, just like you, I used to take it a long time ago. I started having the symptoms of cancer, hair loss, extreme fatigue. It never really helped my pain. But I decided just when I moved back here to Arkansas to just, try to go with what they're saying and try it again.
But see, and that's and so the question is to you is, you SC, so your hemoglobins run pretty half for S. Would that be true for you?
Yes, that's why it's always so hard for me to get treatment, because in Georgia it wasn't, but here they won't even give you blood. They won't even give you pain medicine until your blood count comes back, and it'll come back and it's a 9 or it's 11. Oh, that's pretty good. So you can't be in that much pain. Okay, we're just going to give you a shot of IM and you'll be fine. Go home. I'm sitting here on pain level 10. You know what I'm saying?
Yeah. See, that's discrimination to the fullest, because that's what they like to do here in Cincinnati too. Actually, I've been talking to a lot of people around the country with sickle cell, and it's the same story. You see what I'm saying? And this is why I do what I do here, because that's how they look at us. Just being Black, period. I mean, they think our pain tolerance is at all-time high, let alone being a sickle cell patient. It's like almost, it's almost to the point where they, just playing, experiment, just to be honest. So, okay, so how do you treat your pain besides medication?
Music. I love to listen to music. Reading. I'm a bookaholic. I love to read. I have 4 kids, so I have a 2-year. My youngest is 2, so taking care of him is distracting a lot. I have to do other things, so I can't just sit up and be one of those. Well, I just can't. I can't get out of bed today. I don't have a choice.
Right. You gotta get it in.
I gotta get out of bed. He has to be taken care of, and so. But those are like the main 3 things that I do.
So, do they prescribe you any pain medication at all?
Just got back on it. Like I said, I just moved here after living in Georgia for 17 years.
Oh, okay.
Did not have a problem in Georgia with my pain medicine. The quantities would probably be something people would be like, oh, they prescribed those quantities, because and I'll tell you, I was on at one point 180 oxycodone 30, and for short acting.
Yes.
And then for long acting, I was on methadone 10 milligrams, and I was getting 332. So okay, so I went from that in Georgia, and I moved here to Arkansas with no plan. This was crazy of me though. No plan for a doctor or nothing. So went cold turkey off all that medicine.
So you went through
withdrawals. The hospitals here, like I said, I would go there, and because I wasn't a familiar face and I had just moved here and they didn't have records, medical records on me, all they would do was check my blood count. And like I say, they don't give you anything until that blood work comes back. And they would come back, oh, you're not in crisis because it's a 12. Or it's not a crisis because you're at a 9. I don't know what their magic number is here, but I have not met that magic number yet. And so finally I got in to see a PCP, and I told the PCP, I had just moved here, that I didn't have any pain meds whatsoever. I had nothing, and I had nothing for almost 2 months. So just imagine the hell I was in, because the only thing they were doing at the ER was giving me a shot IM. So I'm, walking around in living hell. And so he gave me 28 methadone pills, 28, and that was it. And he said, but I'm going to send you to a sickle cell specialist, and I'm going to send you back to a pain management specialist. Because that's another thing. I was seeing a pain management specialist in Georgia also. So that's another reason why the quantities were kind of high, in which I didn't have to take all that, but I had it if I needed it, because I was seeing a pain management specialist. So he's like,
pain management, yes.
Yeah, so he's like, I'm going to get you back into pain management, and I'm going to get you back in with a sickle cell specialist. He wasn't hearing from anybody. 2 more weeks, still didn't hear from anybody. But in the meantime, he's still giving me these 28 pills every 2 weeks. 28 pills every 2 weeks. And so, here I am trying to stretch 28 pills for 2 weeks, because that's all he could do, just a PCP. And so I look, these people are not getting back with me. Will y'all just give me the names of them and the numbers and let me call them? Because I have a degree in social work, I can be quite convincing when I want to. And they was like, oh, no, we're going to call them for you. And, we're going to get you in there. And I finally got in. I went to see one in Memphis, and they deal with nothing but sickle cell. It's called the Diggs Cross Sickle Cell Center. And I'm sorry to anybody that lives in Memphis that think they're just great, but they weren't for me. And then yesterday, the day before yesterday, Tuesday, I went to Baptist Cancer Center in West Memphis, and I give a shout out to that doctor. He put me practically back on everything I was in Georgia, and I'm just now getting back stable.
I'm happy to hear that you got that took care of, man, because that really frustrates me, just because I know what you deal with. I'd have been escorted out of hospitals before, kicked out before, police walked me out and tell me to go on back to where you came from, for us, the hospital that has your protocol. And, so I know the frustration, but this is, so what other healthy tactics that you tried? Have you tried anything? Because I know, okay, we would never come off this narcotic. Now, all we probably can do is limit the amount we take, for the lowest dose.
Right.
But the goal will be able to come out. I would love not to be dependent on a doctor. So I do other things that helps with pain. Like just for example, different teas, like I'm drinking tea now, burdock root, just elderberry, turmeric, sea moss, just different things like that, zinc, magnesium. Now, do you do any other things like that for us herbal?
Yeah. I did when I lived in Georgia. I won't lie, I wasn't the healthiest person. I would eat when I wanted to eat. I wouldn't take my, my vitamin D, my folic acid like I was supposed to. Wouldn't drink my water like I was supposed to. And I had gotten so sick that I had gotten down to 120 pounds. Like if you had seen me then, I didn't even look like this person. I was 120 pounds. I was smaller than my 12-year-old daughter. And so when I got here, I will give that, my family, got me back on, like you said, elderberry and sea moss, and introduced me to stuff like that, and tea and stuff like that. And so now I'm 162 pounds. When he weighs me Tuesday, I was like 162. I was 162 pounds in 2 months. Mhm.
That's good. I'm happy that you know what I mean, you basically was able to get back on track though. So dealing with sickle cell, how do sickle cell affect your mental?
Oh my, well, I suffer from depression anyway.
Okay.
And the month after I graduated from college, with my degree in social work, I had my first battle with depression, and I went inpatient and I went on medication. But I came from such a religious family that were so against medication that I let them talk me into going off of medication. And the medication was helping me. I know people always, some people, and everybody has their different things and different ways of dealing with things. But my thing is, if you need this medication, take it. Don't let people tell you, well, pray, pray and God will heal it. It's just a mind thing. And, us as Black people have such a problem with therapy and want to go talk to somebody. And yes, I believe in God too. And I believe God will heal you and you talk to God. But I also believe God put therapists and people here with knowledge for a reason. He can just put these people here, to look pretty,
Yeah.
and they mad because I was going to therapy. They were mad because I was taking medication. I really believe it was mad because I was getting better, because people will get used to you being sick.
They will. They will.
And yeah, and we'll want you to stay that way.
Mm-hmm.
That's the way they're used to seeing you. And if you get to feeling better, and you might get to looking a little too good for them, and then what do I now? Now she don't need me now, Oh, she
Right.
don't need me. I don't get to listen to her cry on the phone no more. Or, oh, she's smiling too much, So
You're
you
right.
have to be about who you keep around you too, because some people like to keep you sick.
I do agree because I'm gonna tell you something. I also say pain management. Sometimes pain management is not always about a narcotic. Sometimes it's about company you keep.
Mm-hmm.
I mean, pain medicine is also about scenery.
Mm-hmm.
I like to go down by the Cincinnati, the Ohio River, just be by the water and just different things and walk through a park and different things like that. But talked about the therapy part. I'm 43 years old. I just started seeing the therapist last year. And I bought me a therapy dog. His name is Loyalty. You know what I mean? He's a Boston Terrier. So these are the things that me fighting sickle cell all my life and not speaking about it, talking about it. This is therapy right here, what we doing. You see what
Right.
I'm saying? You know what I mean? Because a lot of time we keep it here. You know what I mean? And then eventually this motherfucker gonna pop. And that's what happened.
Right.
I started having anxiety, we getting older. You see what I'm saying?
Right.
So, I try my best to take care of myself. I use CBD oils. Of course, I smoke weed. Even with that, I like the different strains that help with that for us, the indica versus sativas. You see what I'm saying? So it's a lot of things that I like to put in place. That's why I like to do this, to see what I'm doing, what you doing, and we can help each other to try something different. You see what I'm saying? So, for the mental health part, I applaud you for, doing the therapy. You know what I mean? If it helped you, I stick with it because it's helping me now,
Right.
and because like I said, just having all these surgeries can play a trick on you, on your mental. You see what I'm saying? Just, you go to sleep one way, you wake up something different.
Right.
I mean, that right there, and then you see people who pass away from sickle cell cause a mental hurdle just to get over
Right.
that. You see what I'm saying? So I'm
Right.
happy that you know what I mean. Now, are you seeing a therapist now, or are you thinking about getting back into it?
I'm not seeing one now because I just got back to this area, but the doctor I saw the other day, he did put me back on the medicine that my therapist was giving me in Georgia.
Okay.
And you find a therapist here, because I've always, as a social worker, I've just always believed in therapy, and some of the things I went through as a child is what led me into the social work field. And I just think it was a calling that I had anyway.
Okay.
But yeah, I'm big on therapy. I
So
believe
now,
that.
I mean, I don't
So,
mean to interrupt. Go ahead. You can what you say.
I just believe so many more Black people could be healthier if
Yeah.
they, and mental wise, if they just get put down this old theory that we don't need therapy, that we so strong, we survived slavery, we survived this. Really, we did survive it, because look how we're still suffering behind it. And if
Yeah.
you just get somewhere and get some help for it, our society, us as a people, we're strong Black people, we would be so much better. We could overtake, the world.
Yeah.
We could rule the world. But I think mental health is just, it's just out of control here in the US.
Yeah, it really is. Even with the theory of we survived slavery, our ancestors dealt with slavery. And we as a
Right.
people, this generation, yeah, okay, we still got our hurdles to jump. So sometimes we got to change our mental on how we think and speak. You see what I'm saying? So, but therapy is the key because you can speak to someone about your issues and you won't hear it back in the street. You know what I mean? Ain't nobody gonna throw
Exactly.
it back in your face, use it against you, because you can be surprised, watch who you tell certain things because they can use it against you later on. You see what
Right.
I'm saying? But is there any support groups down in Arkansas for sickle cell?
A mother of a warrior, a mother that lost a warrior, actually sent me the name of the sickle cell group here in Arkansas, and I think she said the name of it is SOAR, SOAR.
Okay,
I'm
I
not
think I
sure
heard
what
it.
I'm not sure what that acronym stands for, but it's called SOAR. Like I
Oh,
knew all of the ones. Of course, I knew all of the ones in Georgia because I was there so long. But I was when she saw how hard of a problem I was having here getting treated and stuff like that. I commend her. She stepped up and because she was originally from Arkansas too, and like I said, she had a warrior. She had a daughter that died at her early 40s from sickle cell, and she was like, "I'm sorry, but you just went back to an ass backwards place." And I'm like, "Yeah, I did." Here it's like stepping back into the 70s. It's like they still hopping this, you know, fetching for master,
Okay, yeah.
It's ridiculous. I'm like, why do y'all let people talk to you like this? And, like you say, you've been put out of hospitals. I've walked out of hospitals because I just don't want to go to jail, You ain't
Yeah.
finna talk to me any kind of way.
Oh, no, no, no,
No,
no.
I can do that.
Nah, we
So
ain't going for that one now. Nah. So
I
I'm
just
at, so
go on and leave, or we have to go there.
gotta say that. So quick question. What would you like to see change for sickle cell patients?
Um, of course, how we're treated. I would like our disease to be just as important as cancer, just as important as AIDS, just as important as diabetes. You could walk up to probably 10 different people and ask them, and Black people, and ask them if they know what sickle cell anemia is, and maybe 2 of them would be able to say yes. Ask them if they know anybody with it, or maybe 3 of them would say yes. Why is it just not as important as cancer is? Why do you see so many cancer center? Every doctor I've seen since I've been as an adult, except for one place, has been a cancer center. I see, like the doctor I saw the other day, it was a cancer center, Baptist Cancer Center. Why is there not a Baptist Sickle Cell Center?
Yeah,
I would like to see sickle cell centers all over the world, just like you see cancer centers all over the world, just like you see dialysis centers all over the world for diabetes. There should be infusion centers all over the world for sickle cell. We should be able to walk into an infusion center and get hooked up, just like a dialysis patient can walk into a dialysis clinic anywhere in the world and get their dialysis treatment.
I agree because we used to do the infusion centers here and they stopped. And I don't know if they're gonna ever start back, but I usually like to go because I call it a tune-up. That was my terminology for it. And that's when my pain medicine is not working as well. And I don't want to go so high because when you go high on a narcotic, your respiratory drops. So
Right. And your tolerance drops.
Your tolerance drop, and then you got to wing yourself back down to a decent amount to where you ain't always going up in the head. You see what I'm saying? So I do agree. I do agree 1,000%. So we have a few more questions.
Can I ask you a question right quick?
Yes.
So that's the doctor. So do you see a hematologist, oncologist, or do you see a doctor that just specializes in sickle cell?
No, I see a hematologist. Well, I changed the doctor. My doctor retired. And I was forced to go elsewhere because a new doctor came in with an S on his chest, just taking scripts, cutting things. I'm like, okay, I have a regimen that I created that I've been on for 20 years almost. And he came in taking a script from me, which caused me to go back into the emergency room, which I haven't been in 3-4 years.
Right.
You see what I'm saying? So I had to go elsewhere. I'm at a place called OHC here. Is Hematology Oncology Center. So I do see a doctor that specializes in sickle cell, but just all blood. So it's like, because hematology oncology is all blood cancer, sickle cell. So I do have now, yes. And they, she's pretty good. She doesn't, bother my medicine. She don't mind that I smoke weed, because the other doctor I had to leave. He thought that I smoked weed and refused to prescribe me my medication until I forfeit my medical marijuana card. So, which is a
But
whole.
they gave you the card. They gave you the card, right?
Yeah, well, I went to a whole other doctor to get the medical marijuana card. So,
but you had it legally.
Yes, I mean, well, yeah, because my old doctor knew I was smoking weed for years, off and on. I don't do it consistent. I stop, I start, I stop. But the new doctor came in. He got his own beliefs, and he came in and, you smoke weed, I ain't giving you nothing. So, what do? I had to forfeit. He took a script from me, a whole script. He didn't wean me down. He took a whole
pain medicine.
Yes, because I was taking methadone and I was taking oxycodone. He took the methadone. I say, well, my oxycodone allows me to work because, I can function off that during the day. The methadone allowed me to sleep at night, to get my rest, so I can get up and go and do what I need to do the next day. So I say, well, if you're gonna take anything, I guess you take this one, which is the methadone, because I need to take this to work. I can't work off of methadone because methadone will knock me down. You see what I'm saying? So he took a methadone, and so I switched doctors, and so far so good. And I like it. She cool.
That's crazy. I'm on the same meds, but yours does the opposite of what mine does to me.
Yeah. See,
like
strong.
If he would took anything, I would have rather him took the oxycodone, because my methadone allows me to operate during the day. But my oxycodone is what puts me to sleep, and I couldn't do anything with it. How it's crazy how people's bodies are so different.
Yes. But you know what? Like I said, because I was on Oxycontin for a while. Actually, I'm back on Oxycontin now.
I didn't know that they were still prescribing that, because that's what I started out on, and that's how I ended up on methadone. I was on Oxycontin, and that's when the big Oxycontin, debate came out. Yeah. And so my insurance company told my doctor that they had an alternative to Oxycontin, and which was methadone. And so that has been 20 years ago. So I've been on methadone for 20 years.
Wow. See, I just got off. I just got put back on the Oxycontin, but when they took me off of the first Oxycontin, which I'm glad they did, because I was on Oxycontin 80s, and now that sent me through a depression, and they took me out, put me on methadone, and once I switched, they put me back on Oxycontin, but it's a lower dose. It's a 20 milligram. I only take one a day. So on a good day of sickle cell, I could take one oxycodone. I cut it in half, make it 15, and I could take one pill all day. But I'm smoking weed too, off one. I hit a joint and I'm cool. I'm old school. Now I ain't like my mama. I'm like my mama now. So I hit the joint, put it out, and I'm all right. So, I just learned how to cope, because I hate depending on these folks, for my healthcare. I really do, because healthcare is really trash at this point, just to be honest.
So you don't take the methadone anymore?
No, they took me off the methadone. They took me off the methadone. She said she didn't like to describe two different pain meds that's completely different, which is methadone and Oxycontin, because oxycodone is just like a lesser, stronger, not as strong a dose of an Oxycontin. They got the same ingredient, which is opiates. So yeah. So
but the methadone is totally different.
Huh?
But the methadone was totally different, so I don't understand why she took you off of that.
Yeah. So that's what I'm saying, but I try not to even take none of that. I try my best to, I take it to keep me out the hospital. That's right. That's the only time I would take it, because I would have to wean myself down mentally, because, the sickle cell is one thing. Them pain meds is a whole nother thing. You see what I'm saying? So, I try my best to maintain. And cope. So, but I think we had. Let me see. We got a couple of more. We should be done. Okay. What do you want people to know about sickle cell patients?
Oh, for one, that we're not lazy. We are not lazy. We are not weak. Not to brag, but I went to college. and I got pregnant the end of my freshman year. I walked across that campus in crisis, in labor, in pain. I still graduated in 4 years, worked for years as a social worker. Just because we are fatigued, because we have a blood disorder, does not mean that we are lazy. I hate to see, you know, to meet young warriors that have never had a job and never had a career, and for them to think they never can. And that's because people have told them they can't. Because I remember I wanted to be a nurse. I wanted to be a nurse so bad. My mom was a CNA, and I just love nursing because, you know, we spend so much time in hospitals, right? So that was what I wanted to do. I knew that's what I was going to do. My backup career was going to be social work. I had so many people telling me, oh, you're not going to be able to be a nurse. It's going to be too strenuous on your body. You know, we do have to do so much moving around. It's going to keep you sick. You're not going to be able to do it. And I still went to nursing. My first year of college, I was a nursing, you know, major. But I fed into that trap of, I'm not going to be able to do it because the classes were hard. And then, you know, of course, you had your partying lifestyle. I was very sheltered. I led a very sheltered life. So really, I shouldn't even been allowed to go to college in 17 because I didn't know nothing about life. You know, had one little boyfriend, and we had only kids. So, you know, imagine you leaving that type of environment, going to this environment, you got all this freedom and this drinking and drug use and stuff like that. And so, you know, of course, I fell prey to that. I was their biggest, you know, they could look at me and see victim, you know.
Yeah, you was right.
Yeah,
Small town, yeah.
So, yeah, but and I didn't straighten up. You know, I got into drinking. I never was a big drug. I never got into the drug scene, but I was an alcoholic. You know, the one when I was getting carried out the club, and I was like 102 pounds. You know, little thing trying to drink. GPA at the end of the semester was a 1.2. And my mom was like, you're coming home. You're not doing nothing anyway. You're coming home. And so it took me, you know, I got pregnant. And that's what it took for it to click in my mind that, oh, you're going to have another life to take care of. You know, there's nothing for you back home. You got to get it together, girl. And I did. I got it together. I graduated Dean's List. 3.0 GPA. Was hired for my internship. First job, making $24 an hour. You can do anything you put your mind to it. We are not lazy, you know, we're not weak at all. You know, I don't feed into that. To the young warriors, don't feed into that. Don't feed into that. You're not going to be able to do this because of your illness, or you can't do that because of your illness. Your life could be whatever you want your life to be. You know what I'm saying?
I'm happy you said that.
Another thing, we're not drug addicts. We're not drug addicts, drug seekers. Who wants to be on a medication to survive? Who wants that? Like you say, you know, who wants that? Nobody wants that. Nobody wants to have to pack you know, you're packing up for a vacation and you got to make sure you got pain medication instead of making sure you got deodorant. Nobody wants that for themselves. I don't want that for myself. I'm sure you don't want that for yourself.
Nah.
I'm sure if you could get up every morning, just go about your day like other people could, that's what you would do. I'm sure you wouldn't have chose this life if you were able to go back and given a choice that you can live your life with sickle cell, you can live your life without it. So, you know.
I do agree. So quick question though. How do sickle cell affects relationships for you?
I'm married I have 4 kids.
Okay.
I have 3 boys and 1 girl. And so, you know, I had my little college sweetheart. Broke my heart, got me pregnant, you know, but whatever. And then I got married to my husband. And those 2 guys were like night and day. Like, you know, one of them, he would get tired. I'm tired of you always being sick. Of course, we couldn't go out and party like he wanted to party because I was younger and it was my first year of college. His 17th, come to find out, he was a career college student. And then my husband actually was a doctor. Well, he was in med school when I met him, and he became a doctor. Very supportive, you know, wanted to be there for me. You didn't care if you had to miss work, you know, to be in the hospital with me. And of course, then I got pregnant with, you know, by him and, you know, carrying his child and our other kids. Very supportive. So I've had both sides of it, you know. I haven't dated since my 2-year-old was born because I just I don't feel like it. I have a low tolerance for BS. You know
I
what I'm
agree.
saying?
I
It's
agree.
my illness, and if you can't deal with it, you're on about your business.
You know
If you
what?
can't deal with it, because I
I'm a
don't hide
firm.
the fact that I have it from anybody.
Yeah.
And if you can't deal with it, I'm telling you from jump. So from jump, you can leave.
No, I agree. You know, because I'm a firm believer. I can't fight you in sickle cell. You know, so I mean, sickle cell is a thing that's not going anywhere, and it take a lot of energy just to fight. It take a lot of mental energy. So you know, I don't have time to go back and forth with you about minor things. And so I agree. That's why I wanted to put that in there because I know it is a hurdle. I mean, being in a relationship, period, it's a thing, it's a hurdle. But being in a relationship with a chronic illness to where you're not at your best 100% of the time. Yeah, I mean, well, let me not say 100% of the time, but you're not at your best all the time. You see
Right.
what I'm saying? So it's a lot of narrow, low moments. So just the hurdles of that because I know I do speak to a lot of young people that's coming up with sickle cell relationships and I try to encourage them, like, look, anything that's gonna stress you out, walk away from it because that's gonna trigger, some complications from sickle cell. So I do agree with that. We'll go a couple of more questions. We be wrapping it up. So
can I say something about that last? I'm sorry.
No.
But and it's for females. Also, beware of those guys that want to prey on you because you do have an illness. Those ones that want to say, "Baby, I want to help you because you're so sick all the time." But what it is you get a check, and you may be on public housing, and he don't want to work. So all of a sudden, he using that. I can't get a job because I got to be here with you. I'm your caregiver. Don't fall prey into that. Don't fall prey to that. It's a lot of, predators out here. And especially if you have kids, they prey on women. And, there's women that prey on me, but there's a lot of predators out here. Watch your kids. Watch who you're around. Don't fall into that, oh, I love you so much, and I'm not going to get a job, so I'm going to stay here and take care of you. And you've got HUD and food stamps and your check. And so we good.
Yeah.
No, baby. It's something he could do during the night while you sleep. It's something he could do.
Yeah.
And you don't have to be there with you all day because they do have nurses that come in and help you while he go get that job, baby.
Yeah.
Don't be a fool for anybody.
I'm glad you said that because I do. I have came across a lot of my female friends with sickle cell that describe situations that you just described. People just trying to take advantage, trying to get close to them for their medication. You see what I'm saying? So, and all the, but them type of men right there, yeah, you don't need no one like that. You don't need nobody that you have to carry while you trying to take care of yourself. You see
exactly.
what I'm saying? You need someone that's going to support you mentally, physically, emotionally, and while, you being that support for them too. You see what I'm saying?
Right.
If anything less than that, you might as well be by yourself and maintain yourself.
I all by myself, baby. I can do that all by myself.
Until you find somebody that can, want to be that for you. You see what I'm saying? But if anything, if it's causing any heartache and pain, yeah, I throw it away too. You see, you see what I'm saying? So tell me one example of a encounter that you had at the ER with a doctor that was just so disrespectful, just dealing with sickle cell.
I had a lot of those until I moved back here. So recently.
Okay.
I don't know why Georgia, because it's still the South, and Arkansas is so different. Well, yes, I do, because Atlanta, Georgia is such a more progressive city, is what I'll say. And there, a lot of the doctors are more educated and want to be educated on it and things like that. But I didn't encounter a lot of that there. Okay. Here, like I said, I recently just had to get up and walk out the hospital because, anytime, if you went to school, and I'm sure they taught y'all something about sickle cell because you're in there treating it, won't even give you an IV. This man had me laying in the bed. I told you my pain's at a 7. I came from Georgia from all these different medicines that I was on to nothing. So just imagine the amount of pain that I was in. And I'm telling you this, and you can see I can barely lay on this bed. You can see I'm in tears. Won't even start an IV. No oxygen. Well, what is it going to hurt you to give me an IV? You know what I'm saying?
Right, some
That's
fluids.
gonna
Right.
cost you. You don't even have to start it. I have a
Right.
port. You get the nurse to do it. Went and ordered an IV. He went and ordered oxygen. I don't know if he would have gave me a cup of water if I asked for it. Then he took me out the room I was in, talking about they had a more urgent patient coming in. So they took me out of this big room, which down here they so backwards, and so behind the time they only have TVs in the emergency room. You know how most hospitals have TVs in their room.
Oh, man. Yeah,
Don't have
yeah.
a call button. Don't have a call button.
Wow.
Don't have a call button, and put me in this tiny room next to the bathroom where you wouldn't know I was in there if you didn't put me in there. You couldn't see it from anywhere around the nursing station, anywhere. Okay, finally somebody came in and drew blood. And that was it. And I'm just sitting there, and finally somebody came in and did a COVID test. And then I was just sitting there until about 3 hours passed. And I've developed a high, of course I had a high pain tolerance because I've been going through this since I had moved back here. And then he finally sachets into the room and talk about, there's no way you're in crisis because your blood counts are fine. And I sit up and I'm like, what? Yeah, your blood counts are fine. I said, so now there's a test that determines the amount of pain you're in. What test is that? Because I didn't know they had a test that determined pain. But your blood counts are fine. I'm like, but your blood counts don't always tell whether or not you are in pain. That just tell you where my blood levels are. They don't tell you if I'm in pain or not. Well, I'm telling you now that, you're not in a crisis. We're not giving you anything. And I can't do anything.
So it sounds like they just got that pre-notion that we all drug seekers down there.
You're a drug seeker.
And that's why I like to do this, because I think it's crucial for us to educate one another on how we cope, but let alone put that story out there. It's even to the point where it's almost time to call out doctor names, call out hospitals. You see what I'm saying? But I know it's tricky because we can get blackballed. We can get, blacklisted, whatever you want to call it. But at the same time, we still have to, put it in the air. Because like I said, we've been suffering in silence for too long.
Way too.
You see what I'm saying? But one thing, my last
Can you tell me about the incident where you said you got put out the hospital or you were escorted out?
Yeah, for sure. Oh shit, what you want? But but no, on some real stuff. One time, actually, I'm gonna tell you one that happened back in the day. I moved closer to another hospital, and I was in so much of a crisis, I didn't feel like going back to the original, to UC Hospital. This is a hospital called UC Hospital, University of Cincinnati Hospital, over in Avondale. And that's where I go for my treatments and my clinic and everything. They know me there. Basically, I have a protocol. My protocol is 2 cc's of Dilaudid, Toradol, Phenergan, Benadryl, and IV fluids, right? Now, that's a lot. That would knock most people on their back. So now I'm closer to this other hospital, which is called Mercy Health in Fairfield, right? So I go out there. This was probably like 15 years ago when this happened. I go in there, I tell them what the dealio is, what's going on. They come in, they put a IV in, they give me a half a shot of Dilaudid.
Half a shot?
Yes. So I told them everything I took. Hold on, let me back up, because at this time they act like they didn't have Dilaudid. That's what it was. Well, we don't have Dilaudid. We don't have that here. I say, because I went in telling them what my protocol is. I say, this is what works for me, right? Because it helped me save your time and my time of playing this game. I'm gonna tell you, I've been doing this so long, I know it works. I have a protocol. So that he basically tell me, well, go back to UC with that then. We don't have Dilaudid. So they refused treatment that day. So I had to ride all the way to the hospital, full crisis. My head, I'm not all the way there. You know what I mean? So now fast forward, 3 months ago, I go back to that same hospital. I haven't been in years, since 15 years, because they walked me out, I couldn't go back. So I said, let me try them again. I got a new doctor. That's where she reside at. Let me try this again. So I go in there this time. I'm a hard stick. I had a port pulled years ago. That's a whole situation. I don't have a port anymore, but I'm a hard stick. So I go in and I tell this lady, I say, well, the first part where she want to go here. This is the first vein you lose before you're 10 years old. You see what I'm saying? You ain't gonna find no vein in there on me anyway. So let me try. They stuck me about 7 times. So the one time, she finally go to my hand and she digging around and then she hit a nerve, right? So my hand did some go crazy. So now I cussed her the hell out. You see what I'm saying? So I just went off on her. Now they finally came in with a PICC line. They put a PICC line here where they used the ultrasound. So they put a PICC line. This man came in there, wouldn't give me no pain medication. He came in there with a Dilaudid pill, broke it in half, and gave me the half.
In your face.
Yeah, because in my. So I'm like, I see, now this shit is disrespectful now. Like now I feel like a dope fiend. You see what I'm saying? So now I'm heated. Like, you know what I mean? And the only reason I didn't leave that day because I had to get a test, make sure I didn't have a clot. So I wanted my test results to come back and see what my heart doing. Then I left. But it was like the things that we go through. I'm like, okay, I'm in full-blown pain. I have medication at home. It's not working. I don't want to take 90 milligrams of oxycodone at one time with 80 milligrams of Oxycontin. I know what that does to your respiratory. I could damn near kill myself in here. You know what I'm saying? And I have sleep apnea. So my respiratory already, iffy. You see what I'm saying? But, I have had a lot of situations. I done had doctors and nurses call themselves trying to put an IV in, take my hand and squeeze my arm real hard. But now I realized that they massaged me because I was in so much pain, it felt good. I'm like, I said, can you do it again? Like, squeeze a little bit more, squeeze a little harder, matter of fact. But I had we deal with the racism heavily in these hospitals. It's at an all-time high. They really trying to get out of even treating sickle cell patients at this point. You see what I'm saying? So, this is why I do this, you know what I mean? And, just so we can share our stories and find a way to, get the word out and start calling these doctors on what they doing.
Right.
They had it in plain sight. You see what I'm saying? So
I stayed up to 1 o'clock Monday night advocating. Remember you messaged me and asked how I was doing. I told you I was worried about one of my words. I stayed up to 1 o'clock. This girl had been in the ER for 8 hours. And everybody keep talking about, and I'm finna address this too, in these sickle cell groups. If the next person tell me that there's a COVID pandemic going on, like I don't know that. You think I don't know it's a COVID pandemic going on and I live in the US? Well, It's gonna be a long way everywhere because I know that. I even told because I was like, I asked for different associations to reach out for me because I know me. I'm so much I'm gonna tolerate when it comes to my warriors. And this girl had been in the ER for 8 hours. And I had also sat in the same ER for 8 hours because she's in Georgia. And so when I read the post on Facebook, everybody want to come with this, where is the COVID pandemic? And I'm like, oh, when did COVID come out? What? Yeah, I know that. But still, and this hospital has a protocol that sickle cell patients are to be given 2 hydrocodone, 2 Percocets when they come to the door. That's their protocol. Emory, I'll shout them out. Emory in Decatur, Emory in Atlanta, wherever there's an Emory in Georgia. The sickle cell protocol is when you come in there and you tell them you have sickle cell, you're in crisis, you are to be given 2 Percocets while you wait in that waiting room. If 4 hours pass, you are to be given 2 more Percocet pills while you wait in that waiting room. Wow. So I'm calling just to get her 2 Percocets. I'm not calling for y'all to rush her in front of all these people that have been there. Because she said there were people that had been in there longer than her, 3 hours longer than her. So at that point, there were people in there that had been in there 11, 12 hours. So I wasn't saying push them back and let her go to a room. I'm saying the protocol is, and I know what this protocol is because I've been told this protocol is, it's been given to me before. Go down there and get this girl her medicine. Right. It took me 3 phone calls to the head nurse, Chad. And thank you, Chad, because Chad finally got down there and did his job. They did take her back into triage. They did, get her vitals again, and they did finally give her the 2 Percocets. Look, 8 hours. 8 hours.
That was powerful for what you done because that's something that we should do more often. That was very powerful that you called and advocated for her for that to be done. Like I said, even the protocol that they have, I think every hospital should have that protocol when a patient get in, because when they get in, they pain is already at all-time high.
It's already at all-time high. And it's hard to get
what
that
I'm
high
saying?
down to get low to where I feel like you're going home. Because they
Yeah.
think 2 shots, you ready to go home. 2 shots, I'm ready to go home. If I was just going to get ready to come home, I wouldn't have came in here and stayed all this time.
You gotta say that. So quick question,
They
last
think
question.
2 shots is a magical shot. That's another thing too, doctor. 2 shots is not a magical shot.
Nah, that ain't it. So with you fighting sickle cell all your life, what did you then got used to? Like what you got used to when it come to sickle cell? Like what you just grew to like?
Ignorant comments from people talking about it, the pain is all in your head, and I don't know why you're taking that medicine. You must like being high. I don't think you're as sick as you say you are. I just think that you just don't want to do this. Just real ignorant people, and I'm talking about some of these are family members.
Yeah,
we'll be sending y'all this video, so you know I'm talking about
you. Yeah,
just real.
That's sad.
Real, yeah, I've had family members tell me that's all in your head. The pain is all in your head, but they got high blood pressure. So they have blood pressure all in your head, sis, or is it that pork you keep eating?
Hey, I gotta say that.
You know, is that arthritis all in your pain?
Yeah.
Or is it the pain rubs you keep using? You know what I'm saying?
Yeah.
It's just ignorant comments. I'm just so tired of it. It should be, you should know, everybody should know about it, just like I say, know about cancer. When you say cancer, what is sympathy? Sympathy. You don't get nothing but sympathy for that person. Sympathy. Oh my God. Say sickle cell. I don't know, girls. You know about those sickle cell patients, you know?
Yeah.
Come on.
But see, what they fail to realize, like I said, we do, we have a bad stigma. Reputation when it comes to sickle cell, for drug seeking. But what they don't understand when it comes, just speaking for the drug part, we get turned out early as kids. You see what I'm saying? Because I was addicted to morphine at 17. Just thank God that it almost killed me. Because see, they turn us out, and then when we get grown, now we know things. Like, okay, then they don't get it twisted. It probably is a couple of bad apples in every illness, in every field of life. You know what I mean? That don't mean that's everybody in that field of life. You see what I'm saying?
So you were being given morphine at 17. My mom said she can being given morphine at 3-4 years old.
Yeah. That's what I'm saying. We get turned out early. That's a battle within itself to keep remembering why you take this narcotic. You see what I'm saying? And I've been on these narcotics, different type of narcotics since 15, 14. I'm 43. You see what I'm saying?
Taking narcotics until I was in college. I think I got my very first, I'm sure they gave them to me when I was a baby, like my mom said. But then I went through a period where during elementary and high school where I only took ibuprofen. I think I got my first narcotic when I was in college.
Yeah. But see, like I said, even when I was younger, I didn't take consistently. I didn't start taking it, that type of stuff, like I said, about that I can remember 16, 17, consistently. You know what I mean? Even then, I stopped a period of time. And then that's when my avascular started kicking in around about 20 years old. You see what I'm saying? So that's when I really started. The first thing I remember taking besides morphine was Tylox. Now, Tylox it was red capsule. And that was a powerful narcotic. You see what I'm saying? I didn't like to take that either. So, I stopped for a while until I had my first hip replacement. I started dealing with avascular. And that's when they first started writing me for Oxycontin 40s. You see what and I didn't like that at all. So that just accumulated in my medicine cabinet because I didn't like the side effects. I'm like, I'm not used to this drug. I don't want to be taking these powerful opiates.
Right.
But like I said, one thing I got used to is kind of crazy what I got used to. When I'm in a hospital, I'm in the ER, I can tell when the IV is in, when they flush. And the way I can tell it is in because I can taste the metal in my throat. I can taste it. When they flush it, you can kind of hear go to the back of your throat. So that's a little thing I done got used to, and it's kind of weird, and but but do you want to leave anything last? Want to say anything last before we get out of here? You want to put anything in there?
I'm trying to think of anything else.
You got any questions for me? Before you got one last question for me that you want me to answer?
You mentioned addiction to morphine. So do you think that you were truly addicted to morphine, or do you think your body had became used to the drug? I mean, and then how do we distinguish between the two?
Well, back then, I found myself going to the hospital just for that.
Okay.
At a young age, I found myself, but then it almost, like I said, my throat closed. It started to close, and it stopped me from peeing. And I woke up, my doctor came in one day, say, D'Angelo, did you use the bathroom? I'm like, yeah, I just came from the bathroom. She said, you sure? I said, yeah. She said, look at your stomach. And my stomach was like I was 7 months pregnant, like that, like 8 months tight. And they had to catheter me, and I filled up 5 urinals. That morphine stopped me from using the bathroom. I had the sensation as I was using it, and then I was so gone in the head, I'm thinking I'm peeing because I feel like I'm peeing. I was never peeing. So it just messed me up completely, because what happened was I was laying in there, I would be asleep, and the nurse would still come in there and hit me with the morphine, even though I didn't even ask for it. And that's what they did. They just kept doing it. And one day I caught her, I woke up, I'm like, why is y'all still giving me this medicine and I didn't even ask you for it?
Right.
So they just kept hitting me. So I slept for a week, like just drowsy for a whole week. I couldn't wake up. I wasn't in my right mind. I was just.
Did the doctor know you was doing that?
I couldn't tell you, but but the doctor got it right for it. So, unless it was changed back then, like I said, I was 17, 18 years old then at Children's. And this is at Children's Hospital. You see what I'm saying? And that's what they just kept hitting. I'm like, why is y'all? And even now, when I go in there, they be surprised when I turn down medication. I'm like, nah, I'm cool. That's enough. They be like, you sure? They be ready to hit you, like, but it was times I had to turn down meds, and they be so surprised, like, because they think everybody, our pain is different. You can't judge who you just saw that was sickle cell ahead of me. His tolerance, my tolerance, and how I get down, how he get down is two different things. And that's something doctors need to know, nurses need to know. We are more than just a chart. You see what I'm saying? When you open that chart, what you gonna see? You're gonna see Dilaudid, Oxycontin, Methadone, Benadryl, Toradol. You're gonna see all these narcotics. You're gonna be like, oh, he a dope fiend. No, look at how the transition that I done went from amount I used to take that used to be higher to this low dose. It's a journey, like, you see what I'm saying? So a lot of
especially at our
yeah. So it's a process, but they need to understand that all sickle cell patients are not the same, and they need to be a little bit more sympathetic, because we do get turned out early. We get turned out early. It's kids here in Cincinnati right now taking fentanyl as pain treatment. And fentanyl killing all, you already know the pandemic with that. Like, what I mean?
And that's another, what is the difference between the fentanyl people are taking on the street and the fentanyl they're giving us in these hospitals? Because I don't like fentanyl. Number one, I don't like them to give it to me. To me, it's just like water. But what's the difference?
I don't know. I never had it. The only thing I can say is the difference will be the amount. I mean, that's the only thing I can say. That's the difference in it.
In Georgia, I was given it in the ambulance. They picked. I think my truck was broken down, and my son had to call the ambulance for me, and they would know that I was in pain. He asked me to note the number, and I have a port, and usually they'll say, well, we can't, touch your port, so you just have to wait to get to the hospital. But this man was like, I'm going to try to start one in your hand and give you something. And so I'm like, okay, maybe they got some morphine or Dilaudid in here somehow. This man came out with some fentanyl. I'm like, fentanyl?
Yeah, see.
Killing people on the street? He was like, yeah, but this ain't it. This ain't that. I'm like, you sure? Because I got kids. You sure? Like, yeah, this ain't that. But he gave me 50 milligrams of fentanyl. in the ambulance. Didn't touch nothing. I'm talking about it felt like you just put some water in a syringe and pushed it. So halfway, because they ended up taking me to a ER way out from where I live, because they said that the ones around me were packed and they didn't want me to have a wait. Like they're very sympathetic in Georgia. If you're looking to move somewhere as a sickle cell patient and you want good care, Georgia has good care when it comes to, they have. But halfway to that hospital, he said, like, you feeling any better? I was like, Dad, did you even here to give me anything? Like, I'm finna give you some more. 50 more milligrams. Nothing. So I don't know what the difference in it is. I really would like to know, but I just know it don't work for me. And I've had it one other time after that, and it was the same experience. But I only had like I had like 25 of it that time, because the woman didn't believe, and this was in Memphis, Tennessee at Baptist Hospital, didn't believe that I was a sickle cell patient because my hemoglobin was too high for her. But what age were you diagnosed, man? 3. You sure? Because that hemoglobin is mighty high. I don't care how high it is, honey. You think I would have drove an hour from where I live to come to this hospital to wait here 6 hours to lie to you about having sickle cell? She even ordered an electrophoresis. She even ordered another electrophoresis to check me for sickle cell in the ER. Yes.
So
and she gave me 25 of fentanyl. She gave me a shot of Toradol. And then she was like, what did that do? And I was like, what you think it did? And so she was like, well, can you take a little oxycodone, a 15 oxycodone? They came in there with the smallest oxycodone pill I have ever seen in my life. If they make a 1 milligram oxycodone pill, that was it. And I was like, forget this. I'm ready to go home now. I don't even.
Yeah, you got tired of playing that game.
Yeah, tired of playing games.
Oh, man. I apologize. For medicine.
It's okay.
That medicine to get you, boy, I got you just yawning. See, it's funny because that's when I know I've been aching. I don't know if you know, I've been fidgety. My body is aching right now. And if I'm aching too long, I start yawning. So that's a sign that lets me know that, that I'm in some kind of pain right now. And that's why I keep doing things like this. I'm aching right now. So, but that's a sign that I didn't grew to this, that I knew, because I start to yawn and people think I'm sleepy, but I'm not sleepy. I'm just fatigued because I've been aching, since I started this video, so, right. But one thing, like I said, I just to close it out, I enjoyed this conversation. I'm happy I met you, and I will be keeping in touch with you. And what I'm gonna do here is I'm gonna edit this, and I will inbox you, let you know. I'm gonna tag you in it when I post it to my YouTube channel. My YouTube channel is 365 Never Ending Fight. I have other interviews on there with sickle cell patients. Some from Cali, New Jersey. So now I met somebody from Arkansas. So I know we everywhere. So
we everywhere.
So it's a beautiful.
But don't come back to Arkansas, baby. Don't do it.
Nah, I ain't never been to Arkansas. I ain't never rolled through there. So
I should talk like that about my home state, but we so behind. So behind. We got so much to do. Yeah. We got about 20 years of catching up to do.
What's the population in that town?
4,112 people, and I'm probably related to 2,000 of them.
Oh wow! Yeah.
Right. So I don't have a dating life because I'm not going to be right here dating my cousins and all.
Right. Not even know who's who. Right.
Okay.
Now, do your kids? Any of your kids have sickle cell? I know they have.
That's a good question. That's one we didn't cover. My 12-year-old daughter. I have a 22-year-old son, a 17-year-old son, a 12-year-old daughter, and a 2-year-old son. And out of those 4, the third child, my daughter, has SC.
That's cool. What is that, man? Is it just
I'm trying to find that.
That's a hell of a coincidence.
Find that drawing that the doctor made for me, because she did explain it to me why it's like that. And I'm gonna try to find it and inbox it to you.
Is it the chart that shows how both parents
Yeah,
get
it's the
credit?
chart that shows how. And if you look
Yes.
at it, it's the third person's gonna should always fall in there like that.
But I wonder, I mean, but
the
I don't know.
parent, one of the parents has to have the S, you know, because one of our parents had the S
Right.
trait and one of our parents has the C trait, which is
Right.
what gave us the SC.
Uh-huh.
She drew it up to why it felt like that.
But see, I see that. I have drew that chart before myself. I use that same chart, right? But what's the chances of that's to fall like that all the time? What's the chances? Because it's not like that unless it's like, because let's say out of the three, that same chart, right? I'm SC. Let's say I'm SC and you SA, and A is the natural regular gene, right?
Mm-hmm.
So we get a gene from each parent. So the first child we have, you know what I mean? What's the chances of it not coming out SC right away? You know what I mean? Versus AC or SA. Yeah, you know what I mean? What's the chances of, you know, which gene?
I think when it comes,
Right,
I think when you get down to stuff like that, somebody lying about the daddy.
Yeah, that's what I'm saying. Like, but one thing about sickle cell, ain't no lying.
Right.
Hey,
You either got it or you don't. Right.
I had a test with my son when he was younger that I had to get for reasons. And I knew that he gotta be sickle cell trait. If he don't have trait, he's not my son.
Thank you.
Right? And that's just a known fact. Like, you know what I mean? If he walking around here with, if he ain't no trait, because you can't get both genes from your mama. It ain't gonna happen. You know what I mean? Right. You know, but, you know, so that's one thing I have learned too, you know, but I'm very curious of that. You know, that might be something I'm gonna check into, because I have talked to a lot of people. And
my third child and my daughter, she's the girl. She has SC. My oldest son has the trait. My son that I had, the second boy, he has hemoglobin C. So he doesn't even have the trait. He just has hemoglobin C. And my baby has the trait.
See, and that's the difference between SS and SC, because the C, I guess, is not really a sickle as deep as S. You know what I mean? Let me stop trying to be a scientist around here.
Right. Right.
I'm not for sure how it go, but you know, it is what it is. But Rochell, it was a pleasure chopping it up with you.
Pleasure to meet you too.
You're more than welcome. If you ever want to get back on, you know what I mean, we can have a conversation, because this is therapy for us. And you know, if you got any, you know, topics you want to bring up for sickle cell, you know, hit me up. We can do it again. And if I got anything that I want to, you know, just ask your opinion on, I'll hit you up.
Yeah, please reach out.
Yeah.
Hesitate, day or night, reach out, you know.
Yeah, for sure. Well, let me get out of here so I get myself together. And you enjoy your day.
Okay, thank you so much. You too.
All right, you take care, Bert.
All right, God bless.
All right, bye-bye.